Hello, I'm Dr. Hunter Mullen, Associate Professor here at Northeast College of Health Sciences. One of the courses that I teach is ConnecTX therapy. This is an instrument-assisted soft tissue manipulative technique that's used to treat a variety of different soft tissue disorders. Things like tendinopathies, myofascial syndromes, sprain strains, and peripheral nerve entrapments, just to name a few. The way this is theorized to work is by having an effect on the deep and superficial layers of fascia that can lose their normal function in terms of the ability to allow proper glide to occur between the different fascial layers, which can end up leading to painful types of conditions. This is the ConnecTX instrument that we utilize. This is the emollient that is used to create a proper glide of the instrument over the patient. And the way this would be applied would be as an extension of the clinician's hands, either in a superficial manner or by applying more pressure in a very deep manner. And next, I will demonstrate this on a model patient so you can see what this looks like. What I'm going to do now is demonstrate ConnecTX therapy on the thoracolumbar fascia. Our patient is gowned properly and the area is exposed. This area would normally already be warmed up. By that I mean we would place these muscle groups through active range of motion to increase circulation into the area and warm the tissue up. After that, we will apply some emollient, just enough to create a proper friction interface between the instrument and the area that we're treating. So we'll put the emollient on, and we'll start to spread the emollient out. We can use a combination of our hands and the instrument to do that. When we're spreading the emollient around with the instrument, we just call that painting the area that we're going to be treating. Right? And once the emollient is sufficiently spread, we can begin just exploring the tissue with the edge of the instrument. I always use two hands to do that, one on the instrument and one on the area that we're treating. And we want to explore different directions as well, and looking for areas that may start to develop redness like you see here, and keeping an eye on that so it doesn't become excessive. And the instrument helps us to either feel the tissue superficially or to go into the deeper layers with more pressure to kind of break up, or not so much break up, but to enhance the movement of the fascia through the different layers. And we will always add movement to these sequences. For example, we will have the thoracolumbar musculature and fascia activated by having the patient extend their leg, and that contracts the musculature. And then we will ask our patient to slowly lower the extremity as we move along the area that we're treating. And that would normally be done 2 or 3 times in different directions. So now we're going from superior to inferior. You can also activate this area by having the patient extend their head. So go ahead and extend the head, and then lower the head and torso back down to the table in that manner. We always want to be able to come across the tissues as we perform this as well, to pick up different directions of the different layers of fascia that we're penetrating. And that's the basics of how this is performed.